Learning about the cancer diagnosis of a loved one can be a very depressing discovery. A cancer diagnosis causes complex feelings and lifestyle changes that can be overwhelming for you as a loved one. The effect cancer poses on the family varies across different families. For some families, facing the challenges of cancer together strengthens them. For others, the stress of cancer may create new problems and worsen existing problems. Understanding these potential changes that come with this diagnosis can help you maintain healthy and mutually supportive relationships during this challenging time. When a loved one is diagnosed with cancer, it takes a toll on the family. The fear of a loved one being very sick, dying from cancer, and gathering the finances for treatment might bring about anxiety, depression, or a sense of helplessness. Based on the type of family structure, we see different families react differently to the diagnosis based on their coping mechanism. Some families cope by asking every question there is to ask about the disease. They immediately mobilize and are ready to do anything, while other families cope by avoiding talks about the disease because of how uncomfortable it can be. Positive reactions to the diagnosis can give the patient the will to fight for it, while a negative one can dissuade healthy behavior on the part of the patient. The frustration and burden starts to show during the treatment phase, especially in the chronic cases that could take years. Restructuring the family daily activities, trying to keep it as close to normal as possible, running errands, taking the patient for appointments, taking notes during appointments, taking the patient for chemo or radiotherapy treatments, expecting test results and so on can be burdening physically and psychologically. Even during recovery, there's always that fear of the cancer coming back. Today, most treatments are given in outpatient centers, not in hospitals. This means someone is needed to be part of the day-to-day care of the person with cancer, which means people living with cancer are being cared for at home. This role changes as the patient's needs changes during and after cancer treatment. A caregiver is defined here as the person who most often time helps the person with cancer and is not paid to do so. In most cases, the main primary caregiver is a spouse, partner, parent, or an adult child. When family is not around, close friends, co-workers, or neighbors may fill this role. The caregiver has a key role in the patient's care. Good, reliable caregiver support is crucial to the physical and emotional well-being of people living with cancer. Whatever the case may be, support from family members cannot be overemphasized. As the burden of responsibilities compound, we notice some family members neglect, even stigmatize the patients completely, and this can affect their behavior towards this treatment process. Lack of support can cause a patient to give up on themselves and not have a will to live. Family members, sadly, are hardly counseled on how burdensome and depressing it's actually going to be. For the most part, their attention is on the patient, rightfully so, but who is caring for the carer? Some researchers have found that the level of stress, frustration, depression, and fear faced by the family members are comparable, or in some cases, even more than what the patient feels. The financial burden can also be overwhelming because of the immense responsibility involved. The caregiver has to combine work with caring for the patient, going for appointments, and waiting for test results while caring for their own health too. This burden of care extends from diagnosis to treatment and in some cases to death. This feeling of burden and overload might be dependent on the task they have to do. An example is bathing the patient is more burdensome than shopping for them. The patient-caregiver relationship is not a one-way street in which the caregiver gives and the patient takes. Both participants bring both negative and positive to the situation, and both are impacted positively and negatively by the other's behaviors, attitudes, and needs. We encourage both parties to 1. Communicate their feelings or needs. 2. Separate feelings from facts. 3. Ask for more help where needed. We don't see a lot of research which focuses on the carer caring for a relative with terminal cancer. No matter the amount of care required, we find that emotional experience oftentimes can affect and impair the carer's ability to function in daily activities, and this is because of the fact that they are watching their loved one suffer and can't do anything about it. This distress they experience is independent of the care and effort they are making. Prolonged stress can affect their effort to properly provide care. We see the effort reduce over time, and this is destructive on the patient's and the carer's physical and emotional well-being, which is why we strongly advocate for community support and even therapy sessions for the caregivers. If you want to speak to someone, we at Uncle Padi are here to make sure that as a caregiver, you are equally cared for. You can sign in through our app or our website to speak to someone. You are not alone.